Hi, I'm HD, and I'm over 3,000 feet above sea level here at Holywell, one of the must-see places when you come to Jamaica. It's in the Blue Mountain Range, just at the border of St. Andrew and Portland. And today I have a question to ask you. Did you check? Hi everybody, this is my friend Yulit Gordon, the Executive Director of the Jamaica Cancer Society. Yulit, welcome to Season 7 of HD's Jazz.
Thank you, Heather. It's so lovely to be here. Thank you very much for having me. It's such a lovely, breathtakingly beautiful venue.
I know, here in the Holywell Park.
Yes, I have such fond memories of coming to Holywell years ago. And as I look across the mountains and see that fog coming in, I'm just taken back.
It's one of these places that you just have to go.
Oh, it's beautiful. It's lovely.
I'm going to go somewhere else with you here now.
Okay.
Tell us about cancer in Jamaica. How has it been for you, the Cancer Society, making an impact on, I guess, educating Jamaicans about cancer care?
Yes.
How has that been for you?
Well, cancer in Jamaica is a major health challenge for many Jamaican families. The statistics show that over 3,000 Jamaican families are affected by cancer each year. And cancer in and of itself accounts for approximately 24% of all deaths in Jamaica. That is cause for concern.
Yes.
Now, the Jamaica Cancer Society has been around for 63 years. That's how long we've been around.
That's a long time.
And public health education is one of our strategic objectives, one of the key ones, might I say. And that is why every opportunity that we get to engage the public and to have a conversation about cancer and what one can do to minimize their risk to the disease is very welcome by us, as what we're doing here today.
Absolutely. You know, Yulit, one of my challenges is when somebody is diagnosed with cancer, one of the first things that they should be doing is ensuring that their body is healthy and strong enough to work through the challenges of chemotherapy and radiation. So I always recommend that you have a dental check. Any cavities, any gum disease, anything that will compromise your immune system is addressed so that you're better equipped to fight the treatment for cancer. Would you agree?
Yes, and that's the right approach to take, because in fact the World Health Organization shares with us that approximately 30% of cancers can be prevented simply by engaging in a healthy lifestyle approach. So we know that we're to be eating healthy meals. We know that we're to be physically active. We know that we are to stay away from tobacco and heavy consumption of alcohol, as well as accessing those screening tests.
Absolutely.
And therein lies the challenge now, because remember, and for our listeners, screening is not a tool to find cancer. We're not screening to find cancer. Screening is a preventative tool, It is part of the primary strategy for cancer fighting organizations like the Jamaica Cancer Society. So there are some screening guidelines that are in place, certainly for those preventable cancers. So while we're engaging in having healthy meals, being physically active, staying away from tobacco and not consuming high levels of alcohol, we have to also couple or factor in our screening routine. Schedule your screening test.
Here's where I'm going to pull you into what we do in the dental office. Every 6 months, someone comes in for their checkup. We do an oral cancer screening.
Oh, wonderful.
We check the lymph nodes in the neck. We check the floor of the mouth, the lateral borders of the tongue, the cheeks, the roof of the mouth. And that exam is visual and tactile. We want to see if anything feels or looks different. So that one of the reasons why it's good to stick with a provider is, if I have been treating someone for years and I see something strange, I may not know exactly what it is,
Yes.
but it is going to be something that pops out at me.
Yes.
But even if you don't have the same provider because you're doing a regular screening,
Yes.
if anything seems untoward, then you get it checked out.
Absolutely.
And because you're seen every 6 months,
Yes.
you're likely to catch something early.
Absolutely.
And as you know, the
Yes.
earlier things are detected,
Absolutely.
the better.
Right, and it's no different for oral cancer because oral cancer can be effectively treated, but it has to be diagnosed early.
Yes.
And this is where the screening opportunities come in, right? And one of the things we have to ensure we're doing is educating persons on the benefits of being screened.
Absolutely.
Why should you engage in this activity? Because it's not like you're offering free screening now, Heather, you know? And usually the first objection that we hear in our business is that we cannot afford it.
Yes.
We cannot afford it. So cost is a barrier. But we're saying, look at it. How much does it cost to have oral surgery?
Yes.
How much does it cost to access chemo and radiation, Heather? A lot more money than to come and get your routine checks.
Yes.
And oral cancer, although not among the most prevalent cancers in our Jamaican population, there are still incidents of oral cancer out there,
Yes.
right? And therefore, it is important that one understands their risk profile and know how to take the necessary steps to prevent oral cancer from
Well,
happening.
I'm glad you've touched on that
Yes.
because there are actually two categories of oral cancer now. We've always known about the oral cancer that you're more likely or more susceptible to get
Yes.
if you drink a lot of alcohol
Yes.
and smoke tobacco.
Yes.
That basically affects your oral cavity, your
Yes.
tongue, your cheeks, and the soft tissue in your mouth.
Yes.
But now we have an oropharynx cancer
Yes.
that's basically in your throat, back of your
Yes.
tongue, that is relatively new.
yes. Yes.
The cancers that we've traditionally dealt with, the oral cancers, are on the decline.
Yes.
And I think that's because people are getting smart about quitting smoking and
there's more
those things.
education and they're more aware. Yes.
But the throat cancer is on the rise. It's
Absolutely.
connected to the HPV virus, and
Absolutely.
depending on your sexual behavior,
Yes.
it's possible
Yes,
that
yes.
you may be affected
Yes,
with
yes.
that.
And I'm glad that you raised that because that is so true, right? We are learning more. There's more awareness now about the human papilloma virus than ever before because of increased public education and the fact that we now have a national vaccination program for the
Exactly.
prevention of HPV.
Yes.
And what we're seeing happening is that young men and women are engaging in sexual intercourse much earlier than traditional families.
So we need to get the word out.
We need to get the word out, right? So we need to, one, practice safe sex. Use a condom, okay? Limit the number of sexual partners, right? And get tested for HPV.
There you go.
Because the virus is so common out there. It is, in fact, the most commonly transmitted sexual infection. And
Really?
yes, and because it is so common, we would like to use this opportunity to encourage the public to get screened for HPV. So we've been encouraging the women to get their pap smears done, you know, as a means of preventing cervical cancer.
Yes.
But now, with more awareness and education around the benefits of screening for HPV, we'd like to say to women 35 and over that in addition to doing the pap smear, get the HPV test done as well. And for those individuals that have not been exposed to the virus as yet, they've not been sexually active, please get the vaccination. They said that the efficacy of the vaccination, even if you have been sexually active, the efficacy of it still is strong up to age 25.
Okay, so there we have it.
So please get the vaccine or get tested for HPV.
And one more thing I want to say, if you're wearing dentures, take them out at night. Your soft tissue is not designed to be covered, And what can happen is that the tissue can undergo degenerative changes. You don't feel any pain. So another healthy way to prevent cancer is to take out your dentures at night. Take out your dentures, get tested, have the vaccination for HPV, have your regular oral cancer screenings done every 6 months, and you'll be one step ahead of the game. You agree?
What are some of the basic ones to Heather? What's a simple thing like flossing, your dental care?
Well, oral health care will go will go far beyond what we can imagine. So stay healthy.
Stay healthy.
All right.
Stay healthy.
So remember, the Jamaica Cancer Society is here to support you. If you have a diagnosis of cancer, make sure that your body is as strong as it can be. Have all the dental work necessary out of the way before you begin your treatment. Visit your dentist every 6 months so that you can have a complimentary oral cancer screening. And above all, keep healthy, brushing, flossing, and ensuring that bacteria is kept at bay. Listen, I'm here in Holywell enjoying the view. Catch you next time. Facebook, YouTube, and our LFD website. See you next time on HD's Jazz. Jamaica Cancer Society. Welcome to episode 7 of HD's Jazz.
All right, Doc. It's season 7. Season 7.
Here we go. Recreation area.
And actually, I'm getting your nice shoes.
Oh, nice. Yeah.
So, Steph, don't move.
Shiny, shiny.
Oh, the sun's coming back out. Dang it.
Dang it. Dang it.